And welcome back, everyone. This is the last session of the day, fabulous day we've all had, and I'm going to introduce you to Tracy King. Now, those of you who were in the myeloma session earlier will have met her, but for those who don't, Tracy is a myeloma clinical nurse consultant. She's at the Royal Prince Alfred Hospital, which is in Sydney, so she's just come over yesterday to do a talk for our nurses yesterday and 2 talks today, so thank you very much. Tracy has over 30 years of haematology experience and is also a clinical associate professor, research fellow and lecturer at the Sydney University on myeloma. So we're a very valuable resource. So the talk today is titled Living Well with and Beyond a Blood Cancer. Thank you, Tracy.
Thank you so much for the invitation to come and give this talk, which I gave actually 5 years ago, and I've sort of based it on a similar slide set because as I was doing some research for content for this talk, the basic principles of living well with and beyond a blood cancer remain. So if you look up this talk 5 years ago, I look considerably younger than I do now. It was really quite shocking. I was like, 5 years? Are you there only 5 years? But you know what? A lot's happened in 5 years on the planet, hasn't it? So I think it's okay. We all look a little older. And I wanted to title the talk Living Well With and Beyond, because there's a range of people in the room. And my focus in nursing care has started in bone marrow transplant in London, looking after all folks with blood cancers. And we certainly cured a proportion. But most recently, well, the last 25 years, that's recent, I just look after people with myeloma. And myeloma is a chronic blood condition, and people need to learn to live with that. There are great portions of time off drug, hopefully, but you do need to live with. But for many of you, you may be living with and beyond and through to a period of cure. And so I wanted to be able to talk to everybody in the room. And the principles of living well apply to anybody, whether you're living with a current active blood cancer or not. So whilst I do have 30 years nursing experience of folks with blood cancer, I don't live with a blood cancer. So I've brought along Max. He's actually called Maxwell, and right from the day I met him nearly 10 years ago, he said, "G'day, my name's Matt." He doesn't talk like that. Why am I saying that? He does. So I'm sorry, Max, if you watch this. He said, "Hey, Matt, my name is Max. Max Very Well, thank you." And because he's Maxwell, and he always introduces himself as Max Very Well. And I thought I can apply some of his learnings along the way to show you how somebody with myeloma or a blood cancer is managing to live very well. I said, "Max, send me a photo so I can show the folks in the room a picture of Max." So this is him only a few weeks ago, I think, having a beer in his jacuzzi in the backyard of his house in Sydney. You what? Yeah, cheers, mate. See, it does make you talk in that Aussie slang, doesn't it? But this is Max and his wife Alison, with clothes on, as I say. And I'm going to use Max as a bit of an example as we navigate through the last 30 minutes of the day. So what we're going to try and cover is really, what do we mean by living well? We use a lot of terminology, well-being, living well, quality of life, quantity of life, etc. And it's worth just spending some time looking at what we mean by that. Also then to know there's an increased interest from health research and health policy around how we can educate people what we mean by living well and how people can put that into practice. It certainly starts at diagnosis, not after active treatment, and all of us as human beings in society should really follow the guides of living a healthy and well lifestyle. And often we don't until a point of crisis comes along, such as a health diagnosis. So we certainly look at what this means when we're giving a diagnosis of a blood cancer. We'll look at some of the components of living well that come out of the Cancer Institute, what my frame of reference is, and look at really to sew together some of the components of the content of today. Emma and her colleagues at Leukemia and Blood Cancer put together a program like this, not by picking topics out of thin air. The components of the content of this day have been all to help you live better and well with a blood cancer. So you don't only need to learn about your lymphoma, your leukemia, your MDS, your myeloma, etc. Those other really important factors such as exercise, nutrition, sleeping well, etc. are the hallmarks of how we can live well. And we'll end with some components of resilience, which is also an area we focus in healthcare these days to help people live better with chronic health conditions. And of course, this has all been fueled by advances in modern healthcare services. It used to be okay when we first had universal healthcare systems. I did my grounding nursing in London at the NHS and have always practiced in a universal healthcare system. And whilst it might have been okay to initially just manage to find treatments for blood cancers and to be able to deliver those effectively to the broader community at limited cost, it's not okay to just survive with a blood cancer or any chronic condition. We want to survive and thrive. We want to live well and beyond. And I'm sure when you receive your care from the nurses and doctors and teams within the hospitals and the settings, people talk about how to effectively treat your illness, but also how to live well and how it's important to focus on quality of life. And we use that terminology quite a lot as well. And this has been fueled by advances in healthcare system delivery, but also because people are doing better. And people are living beyond a blood cancer diagnosis, or certainly living a lot longer with it. So what do we mean about the parts of living well, so we can go about trying to achieve some of that? When we talk about quality of life, it's worth reflecting on what we mean about that. Whilst quality of life is more than just the absence of disease, we know also that when we talk about achieving a good quality of life, we need to look at not just the absence of disease and health and having good health. We need to look at those other aspects as well. And therefore, we know that quality of life and achieving it is a multidimensional concept. We need to look at our emotional and mental health. We need to be able to function as individuals, as doctors and nurses and husbands and wives and teachers and engineers and whatever else you do, and to participate in life. That's an important part of quality of life, not just health. And more recently is the understanding, and there's some good science and literature supporting this, that what is quality of life for one person is going to be very different to what it may be for somebody else. And therefore, the subjective nature of what we mean by quality of life is worth reflecting on. And at its simplest level, what we mean is what matters to you and what matters to me, and how can we go about achieving some of that? Because that is what is central to living well and quality of life. The Australian Medical Association also have this sort of wellness wheel, which also helps support the various dimensions of wellness. And I've put an arrow there to say that obviously a big portion of that wellness wheel is your physical health. And I think for all of us and those in the room, when we talk about the dimensions of quality of life or wellness, different pieces or different dimensions are going to take different priorities at different times. And we certainly can't focus on all the pieces of the pie. We can only focus on a few of them at any one time, and things are going to change over time. So if I asked you to write down what is quality of life to you and what matters to you now, probably be quite different in 6 months or in a year's time, because things change for all of us. And particularly if you're living with a blood cancer, because you may have periods of being unwell, of very intensive treatment, and periods of stability and moving past and beyond treatment. So whilst we look at the broad components of what we mean by wellness and quality of life, we need to know that it's going to change, and you don't need to focus on all of it, just have an appreciation that they're all important parts of the pie. So reminding yourself what matters to you is a good point to start and a good reflective exercise to undertake. And so I thought I would embarrass myself with some pictures of myself and just sort of, as an example, tell you what matters to me. So first and foremost, my dog. This is Mushka King. Fun fact, we made a spelling error in her name. She was supposed to be called Mashka, which is, my partner's Lithuanian, and that's Lithuanian for little bear. Mashkutas is Lithuanian for little black bear, and she's a fluffy little Labradoodle, but we spelt it wrong. So she's actually, I think it's Polish for fly, but we didn't tell her that. So she's just Mushy. So Mushy's an important part of my well-being. Just looking at her now makes me happy. I also love hiking and walking and tramping, and New Zealanders love that in spades. And so my boots happen to be in the photo, so that's very telling. My family is also very important, and I'm sure for all of you, there are people in your life that are very important. Australia locked down during the pandemic, and we couldn't get out, and you guys locked down as well. So I didn't see my parents who live in Cornwall in England for 3 or 4 years. And this year I did. So this is me and my dad, and he's an important part of my well-being. We're looking very dapper. This is what we wear when we're gardening. I did ask Dad if I could put this up, and he said, "Oh, am I wearing something kind of reasonable?" And I said, "It's fine." He's had that for like 40 years, that gardening outfit. So people are important, and people matter. This is my brother visiting from overseas. My niece was here at university here in Australia for a year. And when her family came to see her after a year, it was like one of those Love Actually moments at the airport. It was just tears everywhere. And then we had an embarrassing flag and some signs, and that helped with the emotion level as well, because humor helps, doesn't it? And it was really nice to spend some time in my family. I happen to live in Marrickville in Sydney, which is the beer capital of Australia. That's another fun fact if you ever visit Sydney. We have about 12 breweries within walking distance, and you can take your dog to all of them. So that's what matters to me as well. And also, but it's not just the people in your social life and your hobbies and your pets, etc. If you think of those portions of what matters, you know, your work matters as well. And those of you still in the workforce or have family in the workforce, what you do, what brings you purpose in life and an income also matters. And so this is me at work wearing, I took 2 random photos, both wearing silly hats. I don't always wear silly hats at work. But on the left-hand side, one of my patients was doing a Move for Myeloma fundraiser, and we had to get these hats and take them in silly positions, and she put them all over social media, etc. But I do love what I do, and I think particularly if you work in healthcare and you work with people in the cancer setting, it's important that you're passionate about what you do. And I think I've never met a nurse that isn't. They don't stay in very long, do they? They're out of there. They don't. And I do love to have some fun at work as well. So one of the patients, they knit a lot of hats in the day therapy when they're waiting so long for treatment. And this one reminded me of Where's Wally? And I wore it for a day last week, just because, and it made me happy. Also the outdoors, I said I like hiking and walking, but being in the outdoors, and I love gardening as well. Those simple pleasures of gardening and being amongst the countryside are really important to me and to many other people. So when we look at what we can do to live well and maximize quality of life, these simple things like getting out and having a walk is an achievable thing to do pretty much for all of you, and really does have great value. I've aged long enough to actually be able to show you my niece and my great niece, which isn't in the last YouTube skit, so because I aged enough to have now great nieces. But these things are important, aren't they? But it's not as easy when you're living with and beyond a blood cancer, is it? Because things change a little bit, and whilst we might think we've had a good quality of life up until that point, that's your first significant health challenge. It does rock the boat somewhat. So a blood cancer diagnosis definitely changes things. And for most of us in the room who've lived through a few decades, we've learned skills along the way of how to manage periods of adversity. We may have had relationship breakdowns, work breakdowns, ill health challenges. We may have lost loved ones as well, and we seem to cope and manage. But a diagnosis changes that, of any cancer particularly. And we do have a little bit of a wobble along the way, not only because physical aspects of our identity change. We may lose our hair, we may put on weight with steroids, or we may certainly have a lot less energy and feel very fatigued, but also it can impact our social, work and financial aspects as well. We may need to leave work early or have financial challenges around the cost of healthcare. And we certainly do live with a lot of uncertainty with a health challenge as well. And that's a very uncomfortable place to sit. We also come into the health system where you meet a lot of other challenges and you learn a very medicalized language and world. And we need to find a way through that, a way to navigate through that. There's a great author called Charlie Mackesy. Has anybody seen any of Charlie Mackesy's images? It's phenomenal. He published during COVID, and whilst he didn't publish for COVID, he became kind of the poster book for COVID, because there's an image of the book is The Boy, the Mole, the Fox and the Horse, and there's an image in there that really tells everything. And this one resonates with me, because at times of change and crisis, the horse is saying to the boy is saying, I can't see a way through. And the horse says, can you see this next step? And the boy says, yes. And the horse says, well, just take that next step. And I think that's a real good starting point at points of crisis, to break down things into smaller portions and to set realistic goals so you can keep moving forward. So how do we learn? What are some of the components of learning to live well? It requires us reflecting on past life experience, because those are some of the skills we can take forward, and to do that in a way that works for us. Setting realistic goals, and those goals need to change over time depending on how you're going and the treatment you may have. There's a chap in the room. I had lunch with Harvey. Is Harvey still here, or he's probably gone? But Harvey has a goal of his 10th grandchild is being born in January. So that's Harvey's goal. And he's like, I just want to get to January. And I think by his story, he's well going to get to January. So that's good. So then he'll probably be on to the next grandchild or something like that. But I thought that was a really nice thing to say. Draw on previous experiences so that you can learn to adapt and reduce the impact of what you're going through with a significant diagnosis, such as a blood cancer. And with that, you will be able to find a way forward to cope and manage. Okay. So I mentioned there were some top tips from the Cancer Institute in New South Wales, and these still resonate and are recommended for things to do, to apply, to take control of your cancer care, whatever type of cancer that may be. And they talk about the importance of team. Predominantly that team may be your healthcare team, but also the team of people around you, your family and friends and community. They talk about getting involved, and we'll work through some of these aspects going forward. And that we know that people do better when they're an active participant in their healthcare. It's not, it used to be maybe 50 years ago that you'd go to the doctor and the doctor would tell you exactly what to do, and you'd say, yes, doctor, and you'd either do it or you wouldn't do it. But these days, the principles of self-management and participation certainly help in terms of improving outcomes for people. The degree to which you need to participate obviously varies. We're not saying you need to do everything on your own, but you need to be part of the team and you need to participate in those decisions. Having good strategies to plan, and several of you have come up to me today and talked about those top tips of planning and making lists and prioritizing and making sure that you plan for those visits with your health team so that you can maximize what you get out of them. These things help as well. And also, it's very rare for anybody to be able to navigate their way through life on their own. People need support. And when it comes to blood cancers, you need the support of your health team, the support of the great people like the Leukemia and Blood Cancer, and also the support of your friends and your family. And there's some tips about how to do that effectively. When it comes to managing your healthcare team, it can be very helpful to understand what each of you bring to that team. Health professionals, busy people, aren't we all though, have a very medico jargonized way of talking, and I'm sure the first few visits and even now probably you may miss a lot of what's going on in terms of not understanding the language you use, but they bring the evidence base, the clinical experience and expertise to be able to help you manage your diagnosis, recommend the right treatment and the way forward. But you bring your individuality and your individual needs and concerns, and those come to the table as well. So understanding what each of us brings is helpful in having effective partnerships with the healthcare team. And those partnerships need to be built on good communication and trust. And somebody said that this morning in the myeloma group, the importance of, and it took her a little while, I think, can't remember the lady there, in terms of trusting your healthcare team. And it may have taken 6 months or a year, but she said it was a big lift off her shoulders once she realized, I can't carry all of this. I can't carry all this understanding and this need to pay attention to all of this. And she learned to trust the team, and it was a bit of a weight off her shoulders. But you do need to be able to do that, and communication can be key. This is Max's healthcare team. We're a friendly bunch. It's a horrific photo, isn't it? It's on our website for something. And we move. We're doing this. It's terrible. But he has in his healthcare team, obviously a hematologist is driving the bus there, but he has also other specialists as part of his team and a whole range of nurses and allied health. But also you need to remember that to stay well and live well with one diagnosis, you need to stay well the rest of you as well. So the primary healthcare team, your GP, and keeping well with everything generally, other concurrent illnesses you may have, your blood pressure, a bit of arthritis, whatever else you may be carrying along, you also need to pay attention to. So they're an important part of the team as well. And Max also learned very early on to engage with any level of support he could. And he dips in and out of that, but he's engaged with the local peer support group and the various patient groups in and around Sydney to help be part of his team. I mentioned communication is very important, and some strategies to have an optimized communication are worth just considering and thinking about. There are difficult conversations you will have with your doctors and your medical team, such as prognosis, probably one of the most difficult, but also intimacy and sexual relations and the emotional aspects. And we know you want to have those conversations with us, and sometimes we don't actively talk about them in very busy, short clinical visits. We might be focused on more of the physical stuff. But I had a conversation with somebody today and who reminded me the importance of those interactions at those medical reviews being individualized to what matters to you. So we're coming back to that phrase again, what matters to you. If you're going for a regular review and you don't really, things are going okay, you don't need to talk about your blood counts and your peripheral neuropathy and anything else and your fatigue, but what matters is you want to go on a visit or a trip, or you're worried about intimacy and relationships and you really need some advice, you need to be able to jot those things down, and when you go into that review, put them on the table as this is what I want to talk about today. Strategies that can help are going with somebody. 2 sets of ears are better than one. People say you remember about 10% of what is told in a medical consultation. So if you take somebody, that's 20%, or it could be the same 10%, couldn't it? It might be. But you might understand things or remember things differently, so you can have a chat about it afterwards. Write things down. We at our facility often offer to, in the Chris O'Brien Lifehouse, offer to record a consultation so that you can make notes afterwards. And we commonly these days also, if somebody can't come with you because they're busy or at their work, get people on the phone in the consult room so that they can be present there as well. And these are good strategies to have. Max always takes Alison either in person or on the phone, and she's often the note taker and the keeper of notes of what's happened in that consultation. We also need to think about how we have conversations and relationships with those outside of the medical team as well. It's very common, I think, for those around you when you come to a cancer diagnosis for people to say to you, because they're not sure what to say, just think positively, you'll be fine. Just keep positive and that will keep it that way. It's not actually possible to keep positive all of the time. You know, life is a bit of a roller coaster, and that's the normal way. Our clinical psychologist always says to me, it's those that are smiling all of the time and very positive all of the time that I'm more worried about, rather than those that are concerned at times when there's difficult things going on. So it's not about lessening the negatives or ignoring the negatives. It's about ways to cope with that can be to focus more on the positives and let the negatives or the hard stuff just sit there to the side. Friends and family around you are also living with a cancer diagnosis and can find it tough and often don't know what to say and find it a real struggle to have conversations, particularly tricky conversations with you. And some strategies that we can put in place to help with that can be to, particularly if there's a lot going on, you're going through a transplant or an intensive period of treatment, a lot of people that care for you and love for you. A lot of people elect a communicator. Social media can help. It's not mandatory, but social media can help using Facebook or blogs or things like that, where you can tell your story and keep the narrative up to date in your room, and then your loved ones can pop in and out of that and see what's going on and be part of your experience as well. It's also useful to think through some scenarios and think through some common things to say into aid communication as well. If people are asking you too much or are prying too much, it's coming from a place of love and care doesn't mean that you need to disclose everything. You can just say, thank you so much for thinking about me and asking me at the minute. I'm okay at the minute, and then flick it straight back to them. How are you? That's a good thing to do as well. But it's quite common also for people need to engage with counsellors and professionals to help them manage the tough stuff and help to communicate with loved ones, particularly communicating with children. That can be really hard and tough, and our psychologists work with parents who have young children to have effective strategies in that regard. Pretty much all people with myeloma are going to be referred to clinical psychology in our service at some time point, even just to check in. Quite commonly when they're on high-dose Dex and feel they're going completely bonkers, and they go and see psychology and they say, are you on Dex? And they say, yeah, I'm on Dex. And they say, well, that's exactly what's driving all of this. So some strategies to think. Some other things to think about as well is I mentioned the importance of being an active participant in your healthcare, okay, alongside your team. And you can do that along a spectrum, okay. And part of the importance of that, the grounding sort of building blocks of that are being informed and knowing your condition. And tick, tick, you're all here today, so you're doing very well in that regard. Following the care plan is also important to maximize health and well-being and get better outcomes for your treatment. And that's not always easier. It's easier said than it is done, particularly with a range of complex treatment strategies. If you're given a whole bag of oral tablets from the pharmacist to sort out when you get home, things do go awry and it's not as easy to stick to the plan. We talk a lot also about healthy lifestyle, and I'll just unpack the elements of that. And we've mentioned the importance of the support services, be those friends and family or the professional support services and patient groups that exist as well. Information gathering has been part of the content of the program today. So I just wanted to reinforce the importance of doing that well. I'm not saying don't Google medical items. We all do it, but just with a little bit of caution. If you ask Google something such as, will eating large amounts of broccoli cure my myeloma, it's going to tell you that eating large amounts of broccoli is going to treat your myeloma, because in there somewhere in that space is going to be somebody that really thinks broccoli cures myeloma, is going to have written about it and posted it somewhere. So just be very cautious about what sources of information you are searching and the credibility and how to interpret that. And I hope that session was recorded today, because you can go back and listen to that from today from Kathy. So be cautious when you're doing that. And also to say that information needs are very changeable. Some people have very low information needs and don't care to read and research, and that's fine too. Other people give that job as a proxy to somebody else. It's a very common role for carers and caregivers to be the information seekers. And also your information needs change over time, okay? And that's quite normal. Following the care plan is not just about taking the right medication at the right time, but making sure you're attending your follow-up appointments and your blood tests and things like that. And that can be challenging if you live far away. One of the pluses of COVID is the increased use of telehealth or video health, and being able to do some of that monitoring at remote sites that we've tried to keep in place. Other things such as treatment schedules and written schedules and calendars for medications. Make sure you're printing out your appointments so you know, and putting them in your phone or on the fridge on a calendar or something like that. And paying attention to other health conditions as well. There's not a sort of pecking order of health conditions in terms of, well, you may prioritize, say, myeloma or lymphoma at some points, but if you've got another health condition that's causing you distress and concern, you need to pay attention to that as well. Particularly those that involve other medications, because you can end up with a whole host of medications, and to take those safely is very important. This is Max. He always shuts his eyes when he has an injection. I don't know if he thinks that's going to make it easier or something. He turns up pretty much on schedule, and that's because he's got an Allison. That's why he turns up. But he has quite a plan to how he manages his appointments and his schedules. And at the beginning, we gave him treatment schedules for his tablets and medication. He had an area set aside at home with his treatment schedule. He used it highlighters, and he had his medication safely in one place. And he's maintained that over 8 years to a lesser or greater degree, because he's been on medications on and off through that period of time. But he certainly pays attention to this stuff. Managing symptoms and side effects is also an important part of living well, particularly when you're still on treatment for your blood cancer. Some of the common things for people, regardless of what type of blood cancer you may have, are about managing blood counts. So making sure you know your numbers and the times you may be at increased risk of infection, or when your hemoglobin or your platelets may be lower, and making sure you know what the signs and symptoms of infection are, and also what to do to act upon them. It's quite common that you're going to get a temperature above 38 on a Friday at about 9 o'clock when you can't call somebody. So make sure you've worked through those scenarios before. What do I do if I get this problem out of hours? Who do I call? Make sure you've got a number. Put it in your box or stick it on the fridge. That's what I need to do out of hours. So when those points of crisis come, you've already pre-planned it, and the people in the household know about that. Fatigue can be a really big problem. And one of the best management strategies for fatigue is actually exercise, and we've had sessions on that today as well. But there can be some other influencing factors around optimizing how you're taking your medication. Poor sleep, we also had a session on that, and nutritional deficits as well, which is why talking about exercise, sleep, and nutrition are building blocks to wellness and well health. Some of the, and there's also been some content talking about the importance of survivorship care plans, and this is particularly important in those people that live beyond a blood cancer and move to a period of being cured and having to manage and monitor for the late and long-term effects of some of the treatment that you've had. So these are strategies that are applied often by the healthcare team with increasing programs to help make sure that mid and long-term consequences of the treatment are managed and are picked up, and a variety of different strategies applied to that often have things such as routine surveillance, exercise programs, fatigue management programs, dietary programs, etc., as well as being cognizant of the various screening procedures you may need to go through. People that have had a cancer and have had treatment for a cancer are at increased risk of skin cancers, you may or may not know. So making sure you do your annual skin checks, things like that, are very important. The Australian Cancer Survivorship Centre has a lot of resources relating to survivorship care plans that include programs around wellness, sleep, nutrition, and exercise. And I'd signpost you to those with valuable resources for you. I asked Max to send me a photo of him having a routine surveillance, and he sent me the one on the bottom left. And I was like, Max, and he said, oh, it's me having a scan. I said, it's not you having a scan. So he's plugged into a bottle of whiskey or something there, isn't it? But that's Max's humor, and it does look a little bit like Max. But that's him having a routine CT skeletal survey, I believe, and turning up, and you become very good friends with the blood sisters, don't you? Because blood conditions need blood monitoring. And so make sure that you're doing those in a timely fashion, and all those other good monitoring and surveillance to help keep you well. We'll talk a little bit about what we mean by a healthy lifestyle, because I think we use that term quite a lot, and it's hard to operationalize that if we don't know what that means. Good nutrition is important, no doubt about it. And I think in principle, what we mean by that is having a balanced diet, all the food groups, but don't restricting the things that make life good and the things that you enjoy. I've probably eaten 80% cake today, 10% coffee, and maybe 5% of the good stuff. So you don't need to follow the nutritional guidelines all the time. It is very important to have a little bit of what you like as well. But paying attention to your nutrition is very important. And a key part of that is maintaining hydration. I think probably one of the things my patients need to be reminded about more often than anything is drink, drink, drink. And particularly when it's hot and you can get dehydrated, one of the things that helps most with kidney health, general physical health, helps with fatigue, helps with sleeping, helps with so many other things, is making sure you're all picking up bottles now. I can see water bottles going up around the room. It really is important. And it is something that only you can do. If you're not drinking enough, then we'll bring you in and we'll put a drip in you and we'll hydrate you that way, and that's not much fun. A great resource there, eatforhealth.gov.au, is for your reading pleasure later. And just proof that when I was on my recent trip home to see Mum and Dad and we were gardening, anybody English here or from England? We drink a lot of tea, don't we? There's no way we would get dehydrated. A cup of tea came out every hour on the hour, regardless of where you were. We were building a big bonfire and doing stuff, then Mum would come out, there's your tea, there's your tea. So I thought that was a good picture to show that the kings are not dehydrated, that is for sure. Make sleep a priority, and I've got a couple of tips there, and I know we've had a content on that, but I'll come back. Don't smoke, it's a no-brainer. It's not good for your lungs, it's not good for anything. Try and find ways of smoking cessation if you are a smoker. And also look and be mindful of what causes you stress, and look at ways at minimizing that. And that might mean that you need help of the professionals. It would be incredibly rare for somebody diagnosed with a blood condition not to have periods of stress and anxiety. And in life, it's quite normal to have periods of stress and anxiety. But if those periods are becoming overwhelming, do seek out some help and support for that. And we'll end with a few things about exercise as well. So there's an increasing body of work being done from various groups internationally and in Australia and probably here in New Zealand at the benefits of exercise in a variety of different ways, not only in helping reduce anxiety and helping people manage, but people experience less symptoms related to their disease or their treatment when they are paying attention to some exercise. It is the principal solution to managing fatigue, of course, along a spectrum, and improving quality of life and physical functioning. There's some guidelines that help support with strong evidence as to the safety and the benefits of exercise in a cancer population. The basic principles are avoid inactivity. I have a patient I was spending some time with last week, and he's really struggling at the minute. He's got a lot of disease on board and some amyloid that's impacting his heart. So he's really finding it quite hard to function too much, but he really wanted to make sure he was making use of his movement and his activity as much as he could. So he made sure that he has a wheelchair that he uses intermittently, and for things like getting from the car park up to the treatment center, that's a wheelchair job. So once he's sitting in day therapy, he can use the energy that he has and the breath he has to move about effectively and interact with the nurses there as well. So at an absolute minimum, avoid inactivity, and then all the way through to having a program of exercise. At a minimum, we should be trying to have several periods a week of creating some huff and puff. Okay, so if you're not doing anything, if you're well enough that is creating some cardio, huff and puff, then you need to step things up a little bit. Resistant exercise is also important. This is Max doing some weights in the gym at the Cancer Center. We have exercise programs that people can join, and we have a prehab and a post-BMT rehab, which is centrally focused around exercise physiology. It's a lot easier to do these things in a program with other people than it is to join a gym and go. I joined a gym once, paid a whole year's membership. Don't think I went once because it wasn't going to suit my lifestyle and it wasn't the kind of thing I was going to do. I felt better about it for a little bit, but it really didn't suit what I do. But I love to hike and I love to walk and I have a dog and I love to do all of these things. And that's what I do for my exercise as well. You can find it very stimulating to use Fitbits and wearable devices to help monitor, and they're very motivating to keep your step count up and things like that. Join a group, join a club, drag your friends with you and do exercise with others, and it's a lot easier in that way. And variety is very important. This is my mum. Shh. They have very poor internet connection in Cornwall, so I don't think she's ever going to see these photos. But Mum broke her leg last year and has to do these exercises for her knee. And so she does them in the morning after she's had breakfast with this squeezy ball that she keeps by the breakfast table. And she sits on the table and she does her exercises. So she has to put, and then she goes out and does gardening, which is good for her as well. But she has to put these exercises into her day in a way that makes sense for her. This is my brother and his family doing the overland trek recently in the snow and the ice. This was only about 4 weeks ago in Australia. This is not something I would do for fun. I do like to hike, but I also like to have a shower and have a bathroom as a minimum standard. These guys didn't. But this is something they like. So my brother doesn't go to the gym. My brother hikes and is very active and makes sure that if he's going to go get a coffee halfway through the day, he does it a kilometer away and comes back. So put exercise and movement into your life in a way that makes sense and fits with you. Sleep really should be a priority. It's very common for people to have poor sleep in the community, full stop. And the risk of not sleeping well are a lot of physical issues, not least weakened immune system, worst experiences of pain, increased risk of falls if you're not sleeping well, and all sorts of other issues. Things in the blood cancer world that can interfere with that, steroids, absolutely. If you're on DEXA, you're going to have some poor sleep. Other medication can interfere with sleep as well. So can, if you're feeling a lot of angst, psychological impacts of a bad day or a bad news, etc., can also interfere with sleep, as well as other things such as sleep apnea, which is not that uncommon either. So paying attention to good sleep practices. This is Max. Clearly not paying attention to the fact you shouldn't have daytime naps, and he's napping there with his 2 hounds. We're doing a study at the minute with a sleep scientist at RPA looking at patients on DEXA with myeloma, which is a big problem. And I've learned a lot about sleep from her. And there are some guidelines in this place as well. The American Academy of Sleep Medicine has some great guidelines on this place. She tells me that the environment for sleep is very important. I think we all know that. A cool, dark, quiet environment. Restrict bed for sleep and sex only. Okay, you shouldn't be eating in bed, drinking in bed, watching telly in bed, sleep and sex only in bed. Can I tell you another fun fact? She also told me there is some research that has demonstrated that women sleep better when they sleep with their dog. Men, this is true, there's studies on this. Men or nobody, so dog or alone, men sleep better when they sleep with their partner. No study with men and dogs, I don't think. Okay, so the environment is very important. Avoid stimulations and stimulus. We know not screens and large meals and lots of alcohol and stuff before bed as well. Also, restricting sleep can help. If you're going to bed and you've got really poor sleep and you're just trying to stay there for hours just to try and get some sleep, then reduce the time that you're in the bed and limit that, and that can be help. Having a regular up and go to bed and up time is also very important, and various relaxation techniques and exercise again. If you do some physical activity in the day, you sleep better, and that's quite commonsensical, isn't it? So 2 minutes, yeah. So we've spoken about the importance of the support services. I think that is it. Tick, 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 tick. Okay, we need to, this video needs to get to the people that are not here, doesn't it? So really, if you haven't embraced them, please do. This is Tim and I. Tim is aging in his photo on his pull-up stand as well, Tim. I came across a great app. Somebody said to me, Tracy, you didn't tell me what happens when you get diagnosed with myeloma. I have so many lasagnas coming to the door. I don't need any more lasagnas. So this app is an Australian app. It's been put together by a doctor and who had a friend who had a diagnosis, which helps put your seeking support activities in line with your friends and family offering support. And you can do that using the app. Give it a go. You guys might want to have a go and see if you can recommend it to other people as well. And it helps make sure you're not getting 20 lasagnas, and you might getting somebody offer to walk the dog plus 1 lasagna or something like that. So there's a top tip for you. Max has his crew and pays attention to his family, his friends. He also supports us as a department in fundraising and participates in peer groups, which he finds very, very, very useful. I'm going to whiz through some of this stuff. It's important to pay attention to the emotional and social aspects in order to have good well-being and health as well. And there are various strategies to do that, some of which have been spoken about today. And I'm just going to end on a couple of slides that just talk about the importance of resilience. The resilience is defined as the ability to bounce back from stressful experiences without lasting consequences. Resilience is not about making bad things not happen, it's about adapting and coping. And one of my patients said, I just want to learn to bend with life and not have it snap me in half. And I think that's a good way of thinking about it as well. And there is an increased focus on this and us being able to build resilience programs or programs that help you live better so that you can build resilience as well. Some of the components of promoting resilience and draining resilience are listed here for you, not least those things we've already spoken about, and having a sense of humor, which I think we've done a lot of smiling and laughing in this day, is also very powerful to help build resilience. This is Max. He has Dutch heritage, so he has his clogs on. And I don't know about New Zealand, but during COVID, we embraced jigsaws. Like, we went bonkers for jigsaws. And Max sent me a photo of him doing a jigsaw, and he happens to be nude. So Max took it to another level, and but he certainly does have humor on his side. Tips to building resilience, I've been through again, and I love the phrase of bounceability. Being able to bounce back from stressful situations, and some of those things we've spoken about. So in summary, we know that a diagnosis of blood cancer is a life-changing event, but it can be positive as well. David spoke about that in his opening motivating talk, didn't he? About the importance of his diagnosis changed him for the good, the worse and positive things. It allows you to think about what's important and what matters to you and the relationships that you have. And we can achieve living well with a blood cancer by learning, by being informed, being active participants in our healthcare, being mindful of the teams we build around them and the communication strategies, and having personable connections with people. Accessing a range of support services. There's a lot of us out there, your healthcare team, and those are the patient groups that are here to help as well. Pay attention to exercise, nutrition, and sleep. Okay, if you can only do 3 things, those are key to living well. And don't lose sight of the small things. They really do count. I found Dave's cancer card. This isn't Dave's cancer card, but I found a Google of it. And so don't forget, you can use your cancer card to make sure that you're doing what matters to you and not what, you know, mowing the lawn or whatever. But as you move beyond your cancer diagnosis, you have to give it up. I think Dave said that as well. You can't use those for life, can you? Some top tips to leave you with resources. They're in the video, so you can go back and look at those. Lots of reading material and things to help you. And I'll leave you with Max, very well, living with myeloma. This was him last week, and I, as we're preparing for this talk, is actually back on treatment recently. Is participating in a clinical trial. Whoever said that's a great idea, which it is, and a great Tibetan proverb in terms of supporting your living well. Key to living well and longer is eat half the cake anyway, walk double, laugh triple, and love without pleasure. And Mushka King said, get a dog, and she put that on my last PowerPoint slide as well. So thank you for your time. I wish you all well. It's been a great day. Do recap and watch some of these great content that has been presented for you today, and I wish you all well on your journey ahead. Thank you.
Thanks, Tracy. That's a fabulous talk to end with. I mean, we've all got tips and strategies now to work with for the future. There's a few thank yous now to go through.
Yeah, we want to thank all the speakers that have travelled throughout New Zealand and Australia to come and present to you today with their knowledge, and also to the Ridges staff and multimedia. Emma Barker, our operations manager, for coordinating this event, and all of our colleagues from throughout New Zealand, and Georgina Sang, who is our administrator, who's been sort of the glue behind the scenes and our go-to for everything. I don't think she's in here; she's out doing stuff.
Yeah, she's on the taxi home.
And of course, you guys, the patients and the support people, the very reason why we do this. So, thank you to you guys.
Please take time to provide some feedback. On page 36 is the QR code, so you can scan that. Just do that at home. What you say today will shape the forum next time, which I think will be in Auckland, maybe next year or the year after. So yeah, we'll look forward to hearing that. So that'll be great. As we said, most of these talks have been recorded, so they'll be available in the next couple of weeks. We'll let you know about that. They'll be on our YouTube site. Yeah. Travel safe, enjoy the city if you're staying here, and see you all at the next forum. Thank you.
Thank you.